Welcome to Medical Confessions.
Your remedy for serious medicine. I'm Jen.
I'm April.
And I'm Scott. Today we're going to be talking about Meth Mouth, and we'll probably just go into methamphetamines in general and why you should never do that.
You can't not connect the two. I found when we were prepping for this episode, like the history and information behind methamphetamines is so crazy that I couldn't just focus on the mouth damage side of it. Well, and I didn't realize, I thought of meth as something more recent, like some weird concoction that kids came up with in the 80s, and I had no idea that it was actually, how far back?
Yeah, 1893 was when it was first synthesized by Dr. Nagayoshi in Japan, and he took ephedrine out of the Ephedra sinica plant.
And did he add anything to it, or was it just from the plant?
He took the ephedrine from the plant.
And that's it.
And then he synthesized methamphetamines from ephedra. In 1919, a different Japanese doc made crystal meth using ephedrine as well.
Japanese.
Oh. Those Japanese, they wanted,
I thought
be
it was
more
just
aggressive.
Opium. I thought it was just poppy seed muffins everywhere. Oh.
Funny.
So the thing that I found interesting too on all of it is that it wasn't, it was intentional. Like they were making it to get the good benefits from it, if you'll call it that. So
Well,
you talked about it used in war.
Yeah, so I don't know what caused these Japanese docs to decide they want to make methamphetamines, but they did. But no, in World War II, it was just known that if you take methamphetamines, you're going to be more alert, you're going to be more agitated, you're going to eat less, and you're going to be able to stay awake for a long time. And those are all very beneficial things for soldiers. So the Germans and the Japanese started handing out meth to their troops, and the U.S. saw those results and said, yay, let's do that too. So, it was estimated about 200 million meth tablets were given to the troops in World War II. And ironically, the biggest problems with meth abuse started in Japan post-World War II because all their troops were wanting their meth because it's also very addictive.
Yeah, and those are the same symptoms that we now see with meth addicts, at all stages of, of abuse. Are those same things, the agitation, the sleeplessness, the crazy symptoms.
Well, and at the time they didn't really study it, so they didn't know all the bad, killing your brain cells, all the problems that come with meth, so they didn't know about it, so they were just giving it to the troops. And it makes me wonder, what are they giving the troops now, right? Like the stuff that they don't know about, but they have these cool beneficial effects,
right?
Like Obama came out a couple years ago and said we're making Iron Man. What do you mean by that? What are you actually doing?
What are you doing to
but I'm
humans?
sure they're not going to tell us.
Right.
But,
right.
Seems interesting.
That's scary.
So, do we think that then post-World War II, that's when the soldiers that had been addicted to it started seeking out, and that's how the problem arose, is because now we're manufacturing it in basements and carports everywhere.
It was a huge problem, 50s, 60s, and 70s. Meth wasn't banned and put on the schedule list by the FDA until in 1970 and 1971, so you had that period between the 40s and the 70s where it wasn't illegal.
And it just, to me, seems like a new drug. Like, it just seems like it's only been in the last 20, 25 years that you really hear anything about it.
Well, fun fact, meth got its street name Crank in the 1970s because people in motorcycle gangs were transporting meth in their crankshafts.
Oh, that's exciting.
I wish I knew more about motorcycle anatomy, so that made sense to me. Where's the crankshaft?
That's the thing at the bottom that your pistons are attached to that go up and down.
Oh.
So like your oil pan covers up your crankshaft, which is like...
Wouldn't that cause...
Yeah, like how are they transporting it, getting the oil in there? Obviously they've got to seal it off, but it's like the people in the prisons who shove stuff up their butts, and you're like, oh yeah, give me some of that drugs.
Yeah, well, if you're desperate, you're desperate.
It was protected.
There was balloons around it. I'm sure it's fine.
Yeah, the whole illegal drug thing just seems so gross to me. Just the
well-
transport methods alone.
And again, now we're talking about people that are addicted to it, so they're not making rational decisions. It's a need. Are there people that are more predisposed to being addicted? So we talked about these soldiers that were given methamphetamines to perform better. Are there certain people then that would stop taking it and be fine, and then others that would not be able to recover? And then even now we talk about it being a really highly addictive, drug. What do they say? Like, the only thing worse is cigarettes, I've heard. And that may not be fact. I don't have a study to back that up. So, but, are there, we'll say like a 19-year-old, is there a group of 19-year-olds where maybe one can use it one night at a party and go, gross, I'll never do that again. But then you hear other times, like, people can be highly addicted after one use. And are there others that will immediately become addicted and not be able to?
Well, because of the side effects of meth and how it's working, it is so addictive because, so I don't think I've ever read something that said this percentage of people, once they try it, they're addicted or not. It's just pretty much known you're probably going to get addicted to it and not be able to get off of it because of how it's changing, dopamine in the brain. And, the reason why it's working is it increases the level of central nervous system monoamines. So those are things like dopamine, epinephrine, norepinephrine, serotonin. The dopamine specifically, the receptor sites in the nerve and how the nerves work with dopamine, you get such an increase in that, and that's what's making you super, super high and excited, I guess, or it's a good feeling. It'll actually destroy those nerves, and the same with the serotonin receptors. And so now if you get off meth, your body's not going to be able to produce the dopamine like normal. The bouts of depression pretty quick are huge when you come off of that. And you're just prone to being addicted to it because you can't get it any other way.
Right.
And so if you don't, then you're always just going to be bummed and depressed, I would imagine.
Yeah, and that's interesting because I know two families that I'm somewhat close to, and they have good families, husband or, spouses, or original parents. There's no, obvious trauma in the households. Both of them have, high functioning children that ended up getting addicted to the drug, and we've watched the families go through several stints on rehab and trying to change behaviors and stuff, and they can't kick it. And it's really interesting to me because I think I've always just thought of it as you're addicted and never really thought about how it's broken down. But they talk about how they feel excited because initially the child is excited and really wants to do, but then they just disappear again. And I guess if they never really can feel that happiness again.
Well, and there's a section of the brain that also, it's hugely damaging to your brain. Your white matter begins to atrophy, the gray matter volume of that decreases. You're literally killing your brain cells, and parts of the section of the brain that have to do with memory get affected, and so the negative aspects of memory go away, and so they literally can't remember the negative consequences of their actions, and so they just repeat the same thing over and over again. It's crazy. It's almost a drug that's just made to make you want to keep using it, and you have to keep using it because you forget that.
It's like chapstick. I'm not
For
kidding.
some of us.
I've got some in my pocket all the time. I can't get off of it.
Oh, it's funny.
Oh. Well, and it's kind of funny because we do, I think, drug education and stuff, and I've always been really baffled when you see somebody who's on meth, and you see them everywhere. You see them walking down the street, and you see them, my kids have seen them, and it baffles me that anybody would want to go to a party. It's not like having a sip of beer. Like, you see people that are doing that, and it's just, I don't understand how people still become addicted to it. At what point do you decide, oh, that meth yoga they're doing looks interesting, I'd like to be twitching like that? At what point does somebody say, yeah, that doesn't look like a good idea?
Well, and the key is just don't do it the first time, right? Because it gives you such a huge increase in all of these feel-good neurotransmitters that it's like, oh yeah, I want that. Like, you're almost addicted right away, it seems like.
Yeah.
So just don't do it the first time, and you'll be fine.
Yeah.
Just don't do that.
Well, and the thing that I've wondered about it as well is, what is the hope for the people that begin to start using this drug? If a family notices it and they intervene somewhat early, we'll call it within a year of them starting, are they ever going to be the same again?
Well, and
are they ever going to get that, hopeful
So the longer you use it, the less of a chance you will be the same again, because a lot of those, like the tweaking, mimic something called serotonin syndrome.
It's just tweaking.
Yeah, like the Beavis and Butthead movement. Yeah.
I don't know, I can't mimic a tweak, it's weird abnormal muscle movements, but basically it's an increase in serotonin, and that's what meth is doing. It's increasing the amount of serotonin in your body, so you're going to get increased heart rates, dilated pupils, you're going to get higher blood pressures, you're going to get all the things that mimic your sympathetic nervous system, and one of that is these abnormal twitches,
Do those twitches only happen while they're high on the medication, or do they happen afterwards?
So, funny story, the more you use it, the more prone you'll be to even having those abnormal muscle movements later on. One particular patient I saw one time, and he could not stop.
No.
And he was slowly losing weight. He was going through so much calories. He hadn't done meth in, months. And I saw him because he was becoming malnourished. He couldn't eat enough calories to
keep up with the movements.
Well, and
I wondered that, and I actually saw a gentleman a couple days ago, and it was sad because he was, still actively high, but extremely kind and very yes sir, no sir kind of answers. And we asked about medical history, and he was very I don't take care of myself, clearly, and the meanwhile he's doing the whole arms throwing up and doing all that. And I kept thinking, how sore is this guy gonna be tomorrow? The movements, and I was just I wonder what that does to your body, that continual movement. And isn't it you can be high for 12 hours?
Well, yeah, the half-life of meth is 12 hours, so you can be having all these symptoms for 24 hours, which is why it's such a cool recreational drug, I guess, is because it's super cheap to make, it lasts a really long time, and in reference, cocaine gives you a lot of the same symptoms, feel goods.
Right.
And its half-life's only 90 minutes, so, it's cheaper, it lasts a whole lot longer, but the problem is it's got a lot more detrimental effects.
Right.
Fun fact, it takes about $200 to make meth and can make you around $2,000 to $5,000 from that batch. So.
We're in the wrong business. We should convert this to a lab. That's
What is
crazy.
it? Breaking Bad?
Yeah, I've never seen that, but
You've never seen Breaking Bad?
don't
Oh,
watch
it's such a
TV.
good show.
Yeah.
I like that one.
I had seen a couple episodes here and there when my husband would watch it, but
I think it just grosses me out, just the thought of,
Well, making it in here would be horrible because there's zero ventilation, and you do need to actually cook it and using hydrocarbons.
We're not even soundproofed in here.
No. You can hear chickens all day long. We would blow ourselves up in here, for sure.
For sure. Well, and there's, so many other side effects to this drug. So there's the really obvious ones that we all see, but we talk about behaviors and stuff that we see in preparing for this episode. We talked about, what did you call it when they continually do repetitive behaviors?
Oh, yeah, so that's called punding. It's a Swedish word for blockhead, but basically they just are doing repetitive, non-goal-oriented tasks.
Yeah.
So women tend to just search through purses for hours
Which
for
I've
no
seen.
reason.
I've seen that, just continuing to dig through stuff, and you're like, what are you looking for?
Yeah, what are you doing in there?
Yeah.
And men tend to play with electronics, is what the surveys were saying.
or take apart cars.
Take apart cars, do random things.
Weird.
Mechanics were big in our family.
Oh, gee.
So
You're
had
connecting all the dots. You're connecting all the dots. So what about the the physical symptoms then that are chronic? So not the twitching and stuff, but that kind of leads way into the meth mouth. So we know when we see people that are probably addicted to meth, some of the obvious signs, like the skin lesions from picking and things like that. But what happens? Why do we end up with things like meth mouth? What is it?
Well, so again, all of the symptoms and things we're seeing with meth use come from that sympathetic nervous system being activated for long periods of time. So sympathetic nervous system, so let's just talk the meth mouth. Meth mouth is coming from about 4 different things. One, you get excessively dry mouth with your sympathetic nervous system discharged for that long. So that dry mouth, dentists have known forever, you need saliva to help, keep your teeth healthy. And so if it's dry, you've got an increased chance of of cavities, it's thought that the salivary glands don't get enough blood flow because, your sympathetic nervous system causes vasoconstriction, so you don't get enough blood flow to your salivary glands, you don't salivate, and you get dry mouth.
So they wouldn't have a good makeout session while they're on this drug as well.
Actually, they probably would, because one of the things it's doing is it's making them very, prone to having sex, and a lot of it, because they actually, your chance of climaxing is reduced, but your ability is still there. So you can have huge, long bouts of sting-like tantra sex.
April's like, I know why people start it now.
So dry mouth is one. The other is the clenching of their teeth and the gnawing of the teeth is a pretty common problem with them. So you got your dry mouth, you got cavities that form, you start gnawing at your teeth, and that's going to break, apart your teeth. And then just poor oral hygiene in general during that time, because you have this super dry mouth. They get really thirsty also because your sympathetic nervous system is activated for so long. You're sweating a ton, so you get dehydrated. You want to drink a lot. They crave, sugary.
Mountain Dew.
Mountain Dew is the number one drink, apparently.
Personal experience as well there. Family members.
I actually saw a patient one time who mistook their Code Red, I guess, is a Mountain Dew, for... They apparently were making their meth using red phosphorus, and so had a bunch of this in a Mountain Dew bottle. He thought it was Code Red and drank it. It did not work out for him. You start taking in a lot of sugary foods, plus you've got the dry mouth, so sugars, that's going to eat away at your enamel. And so just poor oral hygiene, not going to brush your teeth, your dry mouth, you're gnawing at your teeth. Pretty soon you get meth mouth.
So overall, bad oral hygiene, whether it's like, kind of a natural thing because of the saliva glands not working anymore, and also just not keeping up with your teeth. I thought maybe there was some sort of a degradation of the root and bone system in the teeth, so it's not necessarily that, it's external.
I mean, you're going to get...
Eventually,
eventually you're going to get that just from poor oral hygiene.
Right.
And I think the numbers are something like 90-some% of meth users have cavities-ish.
Which doesn't surprise me, because you probably could take the general population. There's probably 25% of people have cavities at any given time.
I have never had a cavity in the history of me.
Even when you were little?
Even when I was little.
What?
My husband's like that too.
Not when I was an adult.
Well, I went even a long time. There was a period of time where I went almost 10 years without seeing the dentist.
Oh my gosh.
Went back to the dentist and they're like, when did you see somebody last? Because your teeth look really good, except for my one snaggletooth up front. But other than that...
that frustrates me because I'm crazy with my oral hygiene. I had horrible cavities as a child, and then even as an adult. They don't have cavities anymore, but I always feel like I'm getting chewed out by the dentist for...
Well, I'm pretty repetitive with my twice-a-day teeth brushing, but that's about it. I don't do a lot else.
I floss, I water pick it, I do everything. It's really annoying. And I don't even have
Maybe your teeth are just getting beat up all the time.
I don't know. But speaking of dentist, both April and I just coincidentally had dental appointments right before this, so we both committed to asking the dentist kind of about...
How did that go?
Well, actually, I talked to the hygienist first, and I thought, well, this will be kind of convenient because I can ask a question and she can talk while she cleaned, and it worked really well. But I asked her, are there, signs, do you see... maybe prior to some of the other symptoms, the twitching and all that, and she said they could, and especially late teens, early 20s, people that are coming in and maybe just starting in processes of maybe they're still in care of their parents, so they're still coming in for their cleanings, but she said they'll see, the enamel, and certain spots, especially right below or behind the front lower teeth, and I guess that's where there's a saliva gland that would normally emit saliva all the time, but she said they'll see it there in the back teeth, as well as other issues like bulimia or alcoholism and things like that. But she actually gave me this whole speech about oral care being the first line indicator of all these other diseases, all these other things, and cancers and sleep apnea and all that kind of stuff. So
is that kind of like the chiropractor who's like, of course you need chiropractic care?
Well, she is the one though. Like they are the ones that told me, like, how do you sleep? Like your anatomy is horrible for sleep. And they ask me every time, have you done your sleep study yet? Because and they do it immediately as soon as like a new hygienist starts working on me. It's almost like they're like, how do you sleep? Like every one of them has done that to me, and I'm like, not good. But yeah, she was saying that it's becoming more of the norm, and that they're surprised doctors don't spend more time evaluating your mouth rather than just a little tongue depressor in the like not really getting in there and looking for other signs of bad health.
See warning signs of other things.
Right.
Okay.
Yeah. So, but anyway, she did say that they do, and I asked her then, when it's progressed and you have really bad teeth from meth, what do you do? And she's like, it's a mess, and a lot of times they don't have money. So she said extractions and partials, and she said a lot of times it's people that have recovered and it was years of abuse, just full on dentures.
Did you say, I'm asking for a friend?
No.
And so she didn't think you're about to start using?
And I actually had to get up my courage. Like, she was cleaning for a while before I was like, I have friends and we do a podcast.
She's like, okay.
Yeah, because I think
on.
when you tell as an adult people that you do a podcast, they're like, oh, cool.
Right.
Right. So, but then I told her. And,
right, this is for a podcast. It's not that you want to go make meth in your small room in your
do you have
barn.
any dental dams? It's for a podcast. No, she was really cool about it, and she went on and on, apparently, because it takes forever to clean my teeth. But that's what I got. I don't know, April, what you gathered from yours.
That was similar.
Yeah.
But she also said that they don't treat a lot because private practice, a lot of them don't have insurance. It costs a lot of money.
Right.
So.
Yeah. Same kind of thing.
Mm-hmm.
Well, yeah, and it's crazy to me because, like you mentioned, all of these things like meth mouth and the tweaking and the killing brain cells, and you're basically making yourself dumber and prone to psychoses and schizophrenias, but yet they still do it. I mean,
Right.
just speaks to how addictive it is and why you should never do it.
Well, and going back to what you were saying about the study, and there was a study done. It was 571 meth users were given exams. 96% had cavities. 58% had untreated tooth decay, and 31% had 6 or more missing teeth.
Wow.
So it's just you're gonna lose all your teeth.
Yeah.
Yeah.
So you better like dentures, basically, is what you're saying.
And this is like one of the few drugs where I feel like there wouldn't be a very long period of time where it would go unnoticed by family and friends. Like you hear of people with alcohol and they function, and cocaine and maybe even heroin and stuff, but it doesn't seem like with methamphetamines that people go long without having very obvious symptoms.
Well, and that you talk about like the pock marks or the the scabs that they get. 40% of meth users, they call it formication, where they actually think there's bugs on their skin, and so they're scratching away at it, and because your sympathetic nervous system is activated at the same time, you got vasoconstriction, so you don't get a lot of bleeding, and all the healing that is supposed to happen doesn't. And plus you've got poor hygiene, so your chance of infection goes up, and now you've got all of these infected skin lesions all over the place, and you see it, and that's like half of them have that.
Well, and some of the things that you're talking about with them kind of losing their memory abilities, they don't remember, their behaviors and things that happened, and just a lot of the symptoms, it makes me wonder. You hear a lot of times that there's a mental health crisis in the U.S., and then therefore we also have a drug epidemic, and I just wonder how often the two are connected. How many times were there mental health issues prior to them becoming an addict? And then obviously I'm guessing after they become an addict, there's some mental health issues maybe that weren't originally organic, but due to the damage because of the drug.
Well, yeah, if you think about how it's affecting your dopamine, you're going to get depressed if you stop, because you can't make the dopamine like you normally would. So you've got depression, plus you've got that aggression that comes from meth mirrors schizophrenia, all their psychoses, and so just in how it's killing the brain cells, pretty soon they are acting like they're schizophrenic once they're off of it. So now not only are you depressed, but you're a little crazy, and you just always want the meth. So it seems prone to mental health problems
Right.
as well.
And so when they get off meth, if they've gone through a course of treatment, do they prescribe them like the standard anti-depression meds, and are they taking meds that maybe would normally go to a schizophrenic? I mean, is that standard practice?
You can give SSRIs, and then there's some dopamine alpha agonists, as it were, that they can give to kind of help, release that dopamine more normally, so you're less depressed. But yeah, SSRIs is a big one afterwards. But again, how that serotonin gets used in the brain, that system is damaged.
Right.
So it's not going to work as effectively as a normal person.
Right.
I would think then, and I'll relate this to a completely different drug. With alcoholism, it seems like there's a number of opportunities or different options for people as far as what their recovery process is. It seems like with this, there wouldn't be a lot of options. Like there's probably just a handful of places that could handle it, and you would have to kind of go down this course, because it's not the same as being able to say, I have a drinking problem, I'm going to do outpatient and go to meetings every week and kind of, I don't want to say cold turkey, but kind of use that. It seems like that wouldn't be an option with meth.
No, you'd almost have to be in a clinical setting where they can manage, your depression, they can manage all of your symptoms, they can give you all of these drugs, because that relapse is going to be so, common. It's going to be so easy to go out and get the drug, and that's just a whole lot easier than this truly lifelong debilitating, can't even say that word, things that are happening to you, and it's going to be there for life because you've already done the damage. It's not going to come back to normal.
Right.
Well, and I know from my experience is when I was learning about the damages of alcoholism or addiction in general, it was, I think, 3 to 5 years that it will take the brain to completely heal itself from your alcohol abuse. I don't know how it relates to meth, but there was definitely people, because I was in the inpatient treatment, some of those handful of people went through the detox system, but then there were some people that, were on heroin that just went straight into the program, and you watched them detox in the facility. They looked miserable. And then there was some, meth users. It was like just an array of different people. Some of them took medications, at med call, and some of them didn't. So it just...
Interesting.
Yeah.
Well, and alcohol increases your dopamine release. That's kind of how it relates to meth. Certainly meth does it a whole lot more.
Sure.
And so it's like less of a dopamine release, but you're still getting that excessive dopamine release. And then so when you go off of it, your body's all out of whack because it's used to having that there and trying to keep things, in that homeostasis range. And then once you're off of it, now it's kind of in a weird environment where it's trying to regulate itself back to normal again.
Right. So I guess my question is, then can their brain re-heal like after an extended 3 to 5 years of no use?
So with meth, no, because you actually get damage to how the dopamine system is working and how the nerves are taking up dopamine and reuptaking dopamine, how it breaks down dopamine. All of that gets damaged. And actually that's why if you take meth, you've got an increased chance of Parkinson's, because that's what Parkinson's is doing as well.
Right.
Is damaging these dopamine, how the dopamine is metabolized in the brain. So if you're on meth a lot, you're going to mirror Parkinson's.
If you make it to an age that
if you can magically kick that habit, which don't know a lot of them who do.
Well, and I was just going to make that point that I know several people that have recovered from different alcohol, narcotics, things like that. I have never met or know anybody that's recovered from methamphetamine use and has a normal life.
Yeah,
I have actually 2 family members.
Do you?
One has got a productive life now, but the other one he impresses me all the time because it was through his teenage years into his early 20s. We hardly ever saw him. His parents sent him through multiple treatment programs, and eventually he just got better. He decided it was time to quit, and he stopped, and he was sober for a long time. He got straight A's through college, ended up being a guidance counselor or some sort of in the recovery field.
Right.
And then the day after he graduated, he relapsed with his his girlfriend, to the point, pretty bad. I mean, pretty
Yeah.
severe consequences. And he's clean again,
Wow.
leading a productive life, and he has a professional job in the medical field. And
That's impressive.
Wow, that is
Yeah.
impressive.
I mean, he's extremely intelligent.
Yeah.
But in comparison, I can put those two together, and it's night and day to see
Right.
the difference between the two. But I just haven't seen anybody like that with methamphetamines.
Right.
No, and I've seen those one patients who we see a lot, and you're like, hey, why do you keep doing this? And they're like, I know, and I don't care. I know this is going to kill me,
They
and
do.
I just
They
don't
say
care.
that I don't care.
Yeah.
Yeah,
it's
I've heard that
crazy to me.
same thing. A gentleman that I know whose son has gone through several years of addiction, and the family's kind of watched him and stuff. And the recent thing that he said to me was, I'm like, how do you cope? And he said, my son's a zombie. He's like, well, I
It's a shell of their former
he
self.
said he's not the kid that I knew, and I can't get through to him, and he won't listen to me, and we've just kind of accepted that. I'm like, that's so sad.
Yeah.
And then now that you're telling us I'm making you the bad guy,
Yeah.
there's not really any hope for major recovery once they get to that point. That's just kind of sad.
Yeah, at one point the damage is done and you can't fix it.
I
But-
don't know. I mean, I have hope still, only because I've seen it. And
Well,
so,
you
and
can
there's
get
probably
better,
a-
sure, but you're not going to get back to where you were.
Well, you
before,
wonder
right?
what would his potential and genius been had he not been embarked on it.
Sure.
But again, we're also talking about biology and medicine and individuals, and everyone's going to be different.
Sure.
So there's going to be those people maybe that don't have the same. There could be somebody who uses for 2 months and will
Yeah.
never recover. So
Yeah, and somebody who uses for a year and they can recover and kind of back to
years,
normal,
yeah.
yeah,
but not really like they were before,
yeah.
I would imagine.
Yeah, and I don't feel like meth is one that we are going to see the soccer mom function on for long. You hear of soccer moms embarking on narcotics and things like that and hiding it for a long time, but I feel like meth is one of those that if a person
Yeah.
starts that process,
You
they're going to
notice,
decline very
yeah.
quickly, and the families their lives will change forever.
Mhm.
Oof, brutal.
Yeah, and I think again, we talked about Meth Mouth specifically, but I would think that, we talk about it and how horrible and alarming it is when you see somebody like that, but I don't think it's just the mouth that is a problem. Like we talked about the skin lesions and sores and the movements and their overall...
Gaunt appearance.
Yes, yeah. Like it's rare that you see one that's, got a lot of weight on their body and functioning, and so I think that, in general, it's a pretty...
Ironically, the FDA does still allow it to be prescribed for severe obesity.
Whoa.
What?
So there are 3 things you can still prescribe it for: ADHD, severe obesity, and I can't remember the
Is
third.
it changed chemically so that it's not quite the same as what we're delivering on
It
the
is-
streets?
It is methamphetamine. Methamphetamine is methamphetamine. There's 2 different types, but they both have the exact same reaction. So, but molecularly, there's 2 different types, but they all have the same increased sympathetic nervous system for a while.
That just seems like especially ADHD, like that just seems like a bad idea.
Well, and that's why it's a Schedule 2 and not a Schedule 1, because you can still prescribe it for that. Now, I don't know any doc that's going to be prescribing meth or even
Right.
for obesity, because the FDA does say you need to really outweigh the harmful risks before you decide that
Like
this
we're
is going to
talking
be the
like
drug.
600-pound life kind of people.
Well, and
maybe.
even at that, there are other drugs other than meth that can increase your sympathetic nervous system as
That's
well.
crazy.
But it is still allowed, but I don't know many docs who actually do that.
Yeah. Well, I don't know though, because we're now in week 3 of 4 weeks of diets that we're supposed to be doing, and I'm so disappointed in mine right now. I almost would rather have done meth for 3 weeks. So
Well, I'm
annoyed.
just over here sweating like a pig.
Well, and
Just
it's
sitting here.
weird that for ADHD, because my son is on some medication and it's called methylphenidate. So, but it's the reaction that he gets from it is so much different than what you would see on the street of
Right.
on meth. Like I can tell when he takes his medication and when he doesn't.
Well, and they're going to control the dose too,
Sure.
right? Like the street, you're getting like huge meth overdoses, and that's where you're seeing the symptoms. If you're
Sure.
going to get it prescribed for this, they're going to be lower doses. You're not going to see these huge, drastic tweaking and that sort of.
Well, pretty serious subject, but good information. And again, you know, we talk about prevention of use and older kids and younger kids and stuff, but I just feel like having this really honest conversation, and I will point it out. You know, like if we see somebody walking down the street that looks like they're on meth, I will point that out to my 9 and 7-year-old, and just in hopes that it'll scare them, that they understand how serious of a drug it is. I don't know,
Yeah.
maybe not
Do
good.
not do it.
Yes,
Because
it's
there are a
not
lot
good.
of good people who thought I could just do it once
One
and I'll be
time.
fine, and
Right.
then they're not.
Yeah,
Ugh.
for sure. So, well, good. And I think it's probably important that we mention, we might have done this at the beginning of our episode, but we are a legit podcast with a website now. We've been promising it for a year, but we're there.
So yeah, go to medicalconfessions.com. You will see the podcast there. We've got 6 episodes up as of this morning. We're putting 1 a day up until we get to the amount that you're seeing on YouTube. So if you're watching us on YouTube, I think we've got 20 or so videos. Right now, we've changed that into about 6 podcasts, and we'll do 1 a day till we catch up to the YouTube, and then they'll just be released weekly in conjunction with each other. And by the time this gets aired on YouTube or on the podcast, we should be on iTunes, because we got an email that says we're under review. So
Fun.
you
So
should,
next time I go to my dentist, I can be more proud.
and actually
I'm doing a
prove
podcast with
that
my
really
friends.
it's a podcast. Look, I
I know.
swear. Instead of they're like, it's a podcast. Which one is that? They look it up. It's not
Doesn't
a podcast.
exist.
No,
It
it's
doesn't.
for a friend.
That's right.
Yeah.
So again, if you like what you heard of Saturday, check us out on YouTube.
Or visit our website, medicalconfessions.com.
We're a podcast as well.
All right.
Welcome to Medical Confessions.
Basically mimics something called serotonin something or other.
Yeah. You're stumped for once. You even dropped an F-bomb in
Yeah.
there. You can keep that out there, but
Oh, I need to look this one up. Serotonin, because it is the reason you tweet. Serotonin syndrome. The word syndrome. Syndrome. The word syndrome.
that's embarrassing.
Isn't it?
We're in the wrong business. We should convert this to a lab.
Yeah. Just giving it to our troops to make them more aggressive and eat less, and yay, that's a good idea.
Healthy